I have 4 kids in that age group, 4 boys in the 5 to 11 age group, and absolutely the day that the vaccines are released for their age group, they will be vaccinated.
Having had my own kids during my time in practice, and patients are aware of that too, I think it's made it very relatable for people to ask me questions about their own kids. And now with the vaccine, it's definitely something patients ask, and I think it makes a really big difference to patients to know that you're practicing what you're preaching and how much you trust in the science and the safety of this vaccine.
The last 18 or 20 months in the ICUs around Hamilton have been incredibly challenging. As I'm sure you're aware, in the 3rd wave in April and May of this past spring, it was an incredible challenge dealing with the huge number of critically ill patients with COVID that we saw, large number of deaths, young people dying of the disease, and the impact that had on patients, on their families, on our staff, and it was unbelievable for sure.
Of course, every parent just wants to do what's best for their child, and I recognize that as a physician and as a parent. So the primary concern I do hear is we just don't have things long term, which may be true, yet the science has been around for a very long time, not just a year and a half. And as well, we do know from vaccine studies, from rigorous data for many years, that most vaccine side effects that happen are going to happen fairly immediately. The other one people do bring up, especially from what we've been hearing in the news and the media, is the myocarditis and pericarditis. But again, I do reassure patients that that is A, very rare, B, if it happens, it is treatable, and usually no long-term deficits and mild symptomatic disease. And the other thing I tell them is that, yeah, your risk of getting myocarditis or pericarditis from COVID are in fact higher than they are from getting the vaccines.
I found the thing the most annoying, that we used to be able to go in the structure and do whatever we wanted during recess, but now it's stayed in designated area and you can only be with your classmates. I used to play, I played flag football, and I can't do it anymore. And I was signed up for baseball, for a season of baseball, but it got canceled.
Well, I found it really hard to wear masks. And it's really hard for school. Also for recess, we can't just run around in the playground. We have our own specific spots we can play in.
I'm a big baby about needles, but I'm excited to get the COVID needle. Just because once I get it, things can start to change once everybody gets vaccinated. And when I'm vaccinated, you can do a lot more things.
I'm actually really excited to have the vaccine for my own children. I mean, I'm just like any other parent the day of. There'll be some, some nervous feelings for the kids, not for me, but for the kids, and, a little bit of probably holding them a little bit, which is fair and reasonable, but I'm excited for them to anticipate a somewhat more return to normal for them. I'm excited for society. I think it's really important for society that we do that. And then I'm excited to be more comfortable around, grandparents in their lives or other people in their life who may be at higher risk of COVID, and knowing I'm doing everything I can to protect those people as well.